1, go.
Hello, I'm Kimberly Hollis, and I will be introducing myself to my patient and letting the patient know I will be assisting in their care today. First, I would ask for permission to proceed with a history and assessment on my patient. And the first thing I would do before I begin my head-to-toe assessment with my patient is I would do a general survey of the patient first. And I would look at like their facial features, make sure they're alert and oriented, look at their behaviors and their well-being. That'd be my first thing that I would be doing. And then the second thing that I would be doing is observing their structure of the body. At this time, I will be conducting a health history, which is done as indicated by age specific of that patient, set forth by the Centers for Disease and Control and Prevention. And a comprehensive history would include a chief complaint, a reason for the visit, a complete review of the body systems, and a complete past family history, along with a social history of that patient should be obtained on the first encounter that I have with the patient. So the next thing I do is I'm going to be introducing myself to my patient and going ahead with the assessment and history. All right, ma'am, let me go ahead and I'm going to get some vital signs on you.
Okay.
Get the hands all washed. I see you already got your gown on.
Mm-hmm.
Alright, let's get your blood pressure and see how that blood pressure is. Alright. Undershirt. Okay, let's go ahead and I'm gonna check your pulse here. Alright, blood pressure looks real good. Real good. 128 over 83. Now that's a good blood pressure right there. Oh, ooh, I just really like that. Okay, so 128 over 83. 94 was your pulse. And your respirations were 16. You were right at ease there.
Okay.
I want to get a temperature, make sure the temperature is fine, and I'm going to do an O2 saturation on you at room air. Put that right up under your tongue there. All right, 98.3. All right. O2 saturation is at 98% on room air. Next thing I need to do is get a weight and a height on you.
Oh.
So, I'm going to need you to take off your shoes. And we're going to get on this scale here. All right. Okay, ma'am. So, let's try to see what we're looking like. Get on this side of you. Okay, we're looking at like 160. Is that about right for you?
That's the meal I just ate.
Oh, you just ate? Okay. All right. Now I'm going to have you to turn around and I'm going to get a height on you. I'm going to be moving this this up. Okay, now just step back. All right. So I'm gonna have you to step off the scale now. And your height there is 64 inches. Okay.
Oh.
So 64 inches. Okay. Sounds good.
Okay.
All right, you go ahead and just put your shoes down there, and we're gonna. Okay, ma'am, I'm gonna check, and I'm gonna see how well you walk.
Oh, okay.
Okay, so just walk this way towards me. Walking looks good. Okay, and then we're gonna walk back. All right. Your gait is all normal. That means you can walk good. Okay, now I want to look at your spine. I want you to bend over. All right. All right. Spine is normal. There is no curvature in your spine, so you can get on up. And I want you to sit here on the bed, and I want to check some strength in your arms,
Okay.
upper extremities. Check the strength. All righty then. So I'm going to put my hands out here, and I want you to push down on my hands because I want to see how your strength is.
Oh,
in your upper
okay.
arm. Okay, so go ahead.
Okay.
Oh, she got some good strength. Okay. All right.
Woo!
I almost pulled off the bed. Okay. All right. Now take your right arm, and then I want you to move this arm around. I want to see how this motion is. Oh, it looks good. Now do your wrist. Okay. All righty. Let's do this side here. Good, good upper extremity movement. All right. Now I'm going to check here. In the bend here of your arm, everything looks good there. And all right, everything looks good there. Oh, good. All righty. Well, everything looks real, real good there. Okay. And so the joints, everything, there was no abnormality in your joints there. Okay. And I'm going to check your scalp. Okay. Everything looks good there. Okay. And good clean scalp. I don't see anything there. And I'm going to check your lymph nodes. So you're going to see me putting my little fingers here, my index finger and my middle finger, and I'm going to be touching in these areas, okay? And see if I feel anything. So I'm going to feel right back here. And this behind the ear, I don't feel anything. Nothing palpated there. And that's your preorbital, okay? And then I'm going to go right behind. Nothing there. Okay, good. Good. All right. Okay. All right. I feel nothing in the lymph nodes there. I palpated, no nodules or anything was felt. Okay. All right. I need you to raise up your eyebrows. Raise up your eyes. Yes. Do a frown on your face. That's a frown on your face. And then I want you to close your eyes. Okay, so your cranial nerve 7 is good, okay? There's no abnormalities. You can open up your eyes now. And then the next thing is I'm going to be touching your face to check sensation on your face. So you can feel that?
Yeah.
All righty then. So your sensation is real, real good.
You got cold hands.
Okay. I want you to clench your teeth together, clench your jaws together. Okay. All right, everything there looks good. So the cranial nerve 5 is intact, okay? And then I'm going to have you to look at my finger, and I'm going to check and see your eye movement.
Okay.
So just watch my finger only, okay? So look up. All right. Okay, you look like you kind of got cross-eyed there. There's no extraocular movements in your eyes, so cranial nerve 3, 4, and 6 are intact. If I would have seen your eye, one eye going a different way, then that would have let me know that you had something going on with your eyes.
Or I was possessed, doctor.
Oh yeah, you could have been possessed. You could have been possessed. Okay. I want to check your skin and everything. Oh, your skin is nice, and so you must use good lotion. Oh, good lotion. And then capillary refill is less than 2. So good capillary refill. And then I want to check your hands. I want to assess your hands and make sure that you don't have any carpal tunnel syndrome. I know you work on computers all the time, so I just want to check that, okay? So I want you to hold your hand out here, okay? And I'm going to come here with my finger, okay? Close your hand up, and I'm going to hold this for about 60 seconds. Alrighty. Okay, open your hand. Alright, so the color is back. Okay, so that test right there, there's no suspicion of carpal tunnel, okay? And then I want to check also another test where I'm going to be tapping on you, okay?
1.
Okay, I'm going to move to the left side of you, and I'm going to be shining this in your eye to check for fundoscopy. All right, everything there looks good. Okay, I'm just going to look in this one. All right, everything there looks good. Okay, I'm going to be checking your arterial blood supply, and I'm going to have you to hold your arm out here, and I'm going to put my hands here, and I want you to close your hand, okay? And I'm going to be blocking this blood supply, and I'm going to see if I see color come back in your hand, okay? So we're going to hold it here. All right, go ahead and open up your hand. Okay, color came back, so you got good arterial blood supply. I want to check for carpal tunnel syndrome, so I want you to hold your hands out like this, okay? And just hold them down. We're going to hold them down like that for about 60 seconds, and I'm going to see if you feel any tingling or numbness or pain while you're doing that. All right. Did you feel anything? Everything felt normal? Okay,
Yes.
so, you know, that's good. Okay, and then I'm going to be checking here, and I'm going to be tapping over this median area here, which is the median nerve, to see if you feel any pain or anything like that. Okay, you don't feel it and everything felt good? Okay, so I know you got good arterial blood supply, and I also know that you do not have any type of symptoms of carpal tunnel. So that's a good thing. Okay? Alrighty. Alright, I wanted to one more time look at those lymph nodes again, because I know I just wanted to make sure everything was good, okay? Alright, so we're going to have the pre-auricle and the auricle. And like I said, I'm using the tips of my fingers. And back here in the very back is your occipital, and right here will be your parotid, and then right here will be your tonsillar, your mental, and submandibular, and your posterior cervical, and your posterior and cervical is back here, and then your anterior cervical here, and then this will be your supramandibular. So all of the lymph nodes are good. I palpated all 10, and there was no enlargements, okay? But I just wanted to recheck that, okay? And so the next thing I want to do, I know I looked at your little arms the last time, and looked at your skin, and skin is moist and not dry, and it looks good to me, okay? And so we're going to do an eye chart that I need you to come over here for and everything. So we're going to move over here. And this eye chart, I'm going to have you, this is called a Snelling eye chart. And it's going to test your visual acuity, and I want you to cover up one eye and then read the line that you think that you can read. Okay? So, on this Snelling eye chart, go ahead and cover up one of your eyes and read the line that you can see pretty good.
I can see EBFCZP.
Great, great. So that lets me know that you have 20/50 vision. Okay, now cover up the other eye and read the line that is most visible to you.
LEF, what is that? GDF, O, look like T.
Mm-hmm. So, yeah.
Oh, that
Uh-huh.
one.
Mm-hmm.
This one right here. I was trying to read.
Oh, you're trying to go all the way down here to the
Yeah.
to the
But I
bottom.
can see the other one.
Okay.
It's DEF,
Mhm.
FPOTE. Is that a G? Or it's a little blurry.
It's a little blurry.
Mhm.
Okay.
See, I got my contacts are near and far. One of them is different. So.
Oh, okay.
Even though I
Okay.
got both my eyes open, I can see.
Okay. So you wear contacts, and like on when you covered up your right eye,
My right eye, this
you were able to see
yeah,
that
but
line.
this really is my near. It's my
Mhm.
near eye. Right
And when
here.
your left eye,
It's my distance.
okay,
Mhm.
okay,
But
all right.
together.
Okay, you can do. All righty then.
Mhm.
So we're gonna go back and sit here.
Okay.
Okay, and we're just gonna look at your little face. And face looks good. Is your head is round. No type of abnormalities or anything there. Okay, so we said with your right eye, 25th, and your left eye, we had 20, 20. Okay. So we're going to check your cranial nerves at this time, and I'm going to check your little nose, okay? And I'm just going to palpate, no deviation in your nose,
Mhm.
okay? So that, where I was checking with my little fingers here, that was your cranial nerve 1, okay? So
Mhm.
there was no deviation in your cranial nerve 1, okay? And then I'm going to inspect your eye lens
Mhm.
again. I know I kind of looked at it yesterday, but I want to look again.
Okay.
All right. All right. Your conjunctiva is pink, and the white of your eye, we call that the sclera. It is white, and there's no discharge in your eyes. Okay. And so that will let me know right there, and your eyebrows are symmetrical and even, okay? And we did the eye chart, and that was your cranial nerve 2, so everything was intact there. And so I'm gonna check your hearing. So what I'm gonna do is I'm gonna rub my fingers together, and I'm gonna do it on the opposite ear. And I want you to tell me when you hear the rubbing of my fingers, okay? So I'm going to put my hand here, and you tell me when I rub my fingers together.
Okay. I hear it.
All right. Okay. All right. So cranial nerve 8, your hearing is good. Okay. If it was abnormal, I would do another test on you, and it would be the Weaver and the Rhine test. But everything was normal there. Okay. The next thing I want to do is I'm going to check your tongue. Okay. And this will be your cranial nerve 9.
Okay.
And so I got a tongue depressor here. And let me go ahead and open this up. And I'm going to put on some gloves real quick. But we're going to be dealing with your mouth. And I see you're chewing gum. That's okay.
Oh, okay.
That is okay. So this is a little tongue depressor, and so I'm going to have you to stick out your tongue, okay, and say ah. Okay, now move your tongue side to side. All right, great, great, great. Now, I'm going to, you said ah, and so that was cranial nerve 10, okay, that we assessed at that time. And your tonsils, you still have them?
Yes.
Okay. And the tonsils were good. And they were a +1. Okay. Now, I'm going to have you to shrug your shoulders. And just shrug them up. Great. All right. So that would be cranial nerve 11. All right. And move your tongue side to side again. Okay. And I'm going to put my hand here, and you just push against my hand. There we go. All right. So that is your cranial nerve 12. Okay. So everything was intact. No abnormalities with the cranial nerves.
All right, sounds good.
Okay. I'm going to be looking in your ears at this time.
Okay.
You got cute little earrings. Little oracle
I
is
hope you don't see
good.
no earwax.
I love earwax. This right here is an otoscope, and I'm just going to be looking in your ear.
Okay.
Oh, okay. There is, I see your tympanic membrane, and it is great.
Okay.
And no discharge or anything inside of the ear. Okay. All right. Everything looks good there. Okay, and the auricle, that's this part of your ear, and it looks really, really good. Okay. No discharge, no foreign bodies inside of the ear. Okay. All right. So the next thing that I want to do is I want to check your pulses.
Okay.
And this right here, just hold your hand. This is for your radial pulse, and it's +2. And check this side here. +2, and then I'm going to check your brachial. Okay, +2. +2. All right. Okay, I want to test your near vision by giving you this chart. And I want you to hold that chart about 16 inches from you. And tell me which line you can read on that near vision chart.
AZEC LPTOT. That one.
This one here. So that will be the 32 inches. You can read that line. 32 inches. Okay. Alrighty, and I'm going to test your accommodation on your eye. But it's not accommodation, it's a confrontation.
Okay.
So what you're going to do is you're going to put this over one eye, okay? And then I'm going to put one over my eye, and I'm going to move my finger, okay?
Okay.
So you put that over your eye. Okay. And I'm going to put one over my eye. Move this table. And just follow my finger. Okay. Now let's cover the other eye. All right. Okay. Confrontation.
Woo! I feel like I'm cross-eyed.
You feel like you're cross-eyed? Okay. All right then. So I'm gonna inspect your nails one more time. I had inspected them earlier. Oh, you got some beautiful nails, but there's no clubbing, no cyanosis in your nails. Okay. All right. So I'm gonna put this vision test up, and I'll document my findings with that. And I'm gonna palpate your trachea. And so what I'm going to do is I'm going to wash my hands and put some gloves on so I can do that real quick.
Okay.
You're not having any pain or anything?
No.
Just feeling good, just here for your annual.
Yes,
Well, that's a
ma'am.
good thing. That's a good thing.
And since I'm passing everything with flying colors, it's free.
Okay. And what I'm going to do is I'm going to palpate your trachea, and I'm going to see if there's any abnormalities there. Okay. All right. All right. Okay, I want you to swallow. Okay. There's no deviation in the trachea, okay, and it's smooth, no lesions or anything is felt with that, okay? And I'm going to come behind you and I'm going to palpate your thyroid posteriorly from the back.
Okay.
Okay, and you're just going to feel me here. Okay, and I'm just feeling it is smooth, soft, and it moves freely. Okay, and I'm going to come up in the front, and this is anteriorly. It's movable, soft and smooth. Okay, so no deviation there and no abnormality in that. Okay, so now I want to palpate your chest area. Okay, and so I'm going to come behind you. And I'm just going like this. Front. Look at your breathing. Okay, your respirations are good at 16, unlabored, breathing pretty freely, okay? And that's going to do it for just now, okay? I think we're going to move on to something about the cranial nerves, but I need to go back over those with you one more time. Okay. I need you to close your eyes, and I'm going to put something under your nose, and I want you to identify what it is. I'm going to be just testing your olfactory, okay, which is your cranial nerve 1. Okay. So I just need you to close your eyes. What do you smell?
Coffee.
That's right. So cranial nerve 1, which is your olfactory, is intact. Okay. All right. So we already did the Snellen eye chart and we did the near vision eye chart. And so I already know by that visual field and acuity test that your cranial nerve 2, which is your optic, is intact. Okay. So that was previously done, so I just wanted to let you know that. And right now I'm going to be darkening the room and I'm going to do a consensual response on your eyes, okay? So at this time I'm going to try to cut down on the light, okay? And I'm going to shine this light in your eyes, okay? All right. Okay. All righty then. So that right there, I was testing for your consensual response in your eyes, okay? And then I'm going to be testing your cranial nerve 3, 4, and 6, which is your oculometer, trochlear, and your abducens. So I need you to look at me and look at my finger, okay? Okay, there was no extra ocular movements in your eyes, so I already know cranial nerve 3, 4, and 6 are intact, which is your oculometer, your trochlear, and your abducens, okay? And then the next cranial nerve that I'm going to be, this is dealing also still with 3, 4, and 6, so I'm going to bring some fingers over from the side, and I'm going to test your peripheral vision to see if I see any involuntary jerking in your eyes, okay? So I'm going to come over here, okay? Alrighty then, so I see no involuntary jerkings or any extra eye movements, and there was no nystagmus, okay? Now I'm going to be checking the pupils again, so I'm going to shine this light in your eyes to check and see how your pupils are looking, okay? All right. The pupils are equal. They're round. They are about, the pupil is about 2 millimeters in size, round, reactive to light, and accommodation. Okay. And I'm going to check sensation on your face. And so I'm going to be touching your face and asking you to clench your jaws so I can check your trigeminal cranial nerve, okay? So right now I'm going to have you to clench your jaws. Okay, all right. And if you can feel this,
Mhm.
all right. Well, cranial nerve 5, which is your trigeminal cranial nerve, is intact.
Okay.
I'm going to have you to raise your eyebrows,
Oh,
frown,
Frown.
okay, and then I want you to puff your cheeks out like this. All right. So, and I want you to smile. Okay. So, cranial nerve 7, which is your facial cranial nerve, is intact. Okay. And I've already seen your face at rest. It looks intact. And then I'm going to be testing your cranial nerve 8, which is your acoustic, which is your hearing.
Okay.
So I'm going to be doing a little test, and I want